Welcome back to our second webinar on GLPs. The first webinar, we talked about what GLPs are, what they do, the side effects, some concerns, and how to microdose and how you can successfully microdose. Now, today we're moving on to how you can, one, eat and have a better effect from the GLPs through lifestyle, how you could increase your GLPs naturally, and how you can come off the GLPs when it's the appropriate time. So we're excited that you've joined us for this second webinar, and we'll get jump right in.
Okay, so we're going to kind of go through the nutrition and lifestyle support for the GLPs, like nourishing our body, supporting our gut, our bones, our sleep, working with fatigue, which can be a known side effect of the medications, and then making sure we're building a support system around them as well. Those components are kind of we reference the pillars oftentimes in a lot of things we're doing because building that strong foundation is important, and these are kind of the pillars to the GLP drugs as well. So nutrition while on a GLP, it's still going to be the same as when you're not on one as far as we want to eat a whole foods diet, meaning the food is what it is. You can pick it up and look at it, you know what it is. It doesn't have an ingredient label. If it doesn't have an ingredient label, then we want to shoot for 5 foods or less, which would be limiting that ultra processed food. Make sure that we're checking for and being mindful of some known nutrient deficiencies, whether that's some of the ones we talked about previously, like vitamin D, iron, B vitamins, calcium. And if we do know we have those deficiencies, we're increasing foods rich in those items and supplementing as appropriate. We really want to make sure we're focusing on protein. So typically for most people, that's going to be that 1 gram per pound of your ideal body weight. So that's going to be, obviously we have a lot of different sized bodies, but that's probably the lowest end for anyone's stature is 100 grams. Most people aren't even getting that. So if you're a taller male, that's going to be much, much higher than 100 grams. But for the most part, that lower end is probably going to be 100 grams for most people. You may have to set reminders to eat because those food signalings may be diminished a little bit. So you're not getting cues to your brain, to your gut to say, hey, it's time to eat. So setting reminders or being very mindful of when meal times are kind of blocked off. Maybe depending on your job, you may have a lunch hour blocked off on your schedule. That should serve as a reminder to nourish your body. Work with somebody who's trained in this. So meet with us, come into our clinic, and we can help you come up with some different strategies and implement some different things to make sure that you're nourishing your body well. And then utilizing meal replacement products like functional foods, those powders or beverages that you can incorporate into your day to day to make sure you're getting nutrition, getting enough calories, getting enough protein, fueling your body.
So, the big thing with this slide is we have to decrease our ultra processed foods. That's where all our chronic diseases come from. And as Ashley said, if the label has more than 5 items on there, try to stay away from it. And you should be able to know what those 5 things are and understand it versus things you can't even pronounce or know what it is. So 5 items or less on the labels. Best foods are the ones that don't have any labels, such as our fruits and vegetables and quality meats. And then as far as working with a nutritional professional, I know we all think that we know everything, and we don't. We have listened to upwards of 10 webinars on GLPs and learning every day. We listened to one again this week to gain more information. We're going to a conference in 2 weeks to learn more about GLPs. There's always stuff coming out and always ways we can do it. So this is not a pill or injection and nothing else. You need to change your lifestyle and you need to work with somebody to do that. And we're here to help you.
And I would say that this piece of information, the nutrition, is probably the most important one of all of them. Everything else is very necessary, everything else is very supportive. But just in regards to weight loss alone, people are going to be very hard pressed to maintain or even to lose a lot of weight from exercise alone. The nutrition piece is very, very important. And so, not only do you want to make improvements so that you feel better, but if you don't change your nutrition while you're on the GLP, when you come off, you're probably going to be very similar to where you started. You have to make those changes while you're on it, and nutrition is probably 80% of what you need to work on. The gut is huge. I mean, you can't talk about any topic without being able to tie it back to gut and gut health. And our microbiome, which is that little ecosystem, or very big ecosystem actually, that lives inside of us, is very strongly linked to food preferences, food timings, how we eat, what we eat, when we eat. So we need to support that while we're on the medication so that when we're off of it, or if we're off of it, we're not right back to where we started. And then also the foods we eat do help to kind of groom that ecosystem. And so when you're on your GLP medication, you may be eating differently, you may be eating less, so you may be not supporting that gut microbiome as much as we should. So you got to make sure you chew your food well. And that's because you can't have big pieces of food going into your belly and expecting your stomach to be able to digest that well. It's just not. And if it's not broken up already by your teeth, it's more work for your belly to digest, and then you're not going to pull all those nutrients out. We want to eat a variety of plants because those all have very specific, very different fibers in them. And that's what our um, gut microbes like to eat. Because we're maybe not as hungry, you need to eat smaller meals, but eat them more often so that we're making sure we're getting enough nutrition for us and for our microbiome. Um, be mindful of our fat intake, trying not to lie down after you eat that simply because that's going to help with digestion so that that mitigates that heartburn or reflux sensation. Limit alcohol, drink ginger tea can help soften some of those side effects that you're going to see potentially with the medications. And then if you have persistent gut issues, things that are more than just a little irritation, you probably need to dig a little bit deeper into that and decide if this is something that would require you to stop the medication.
So our microbiome is so important, and we can't emphasize it enough. Your gut health is attributed to your brain health, your skin health. Everything is related to our gut. So we want to make sure we have a good, healthy microbiome by eating a variety of foods. The foods we eat feed the bacteria that want that. So if we eat junk food, we're going to have a bunch of bacteria that like junk food. We want to eat the good food to create good bacteria in our stomach. And with that fat intake, fat is not the enemy. Fat is important to us. It's important for multiple parts of our system. You want to make sure you're eating good quality fats like olive oil, avocados, and make sure you're getting that good fatty foods in.
So the mouth also links very closely to our gut. Our mouth there's an oral microbiome as well, but our mouth is essentially is part of our gut because everything that goes in our gut is going to first go through our mouth. So make sure we're hydrating well so that our mouth isn't drying out. We're maintaining good dental hygiene by seeing your dentist regularly, but then also doing your typical brushing and cleansing of your mouth appropriately. And then avoid a lot of sugary beverages and things that have that sugar that's going to sit in our mouth. In regards to like the dental hygiene, it's important to recognize that we want to keep our mouth clean, but some of the products we use can almost be so harsh that it kills off even the good bacteria. So we don't want to overdo the mouthwashes. We don't want to overdo like brushing many, many, many times a day. Certainly, you want to brush your teeth twice a day, and you want to make sure that your mouth doesn't taste and smell bad. But you shouldn't be gargling with mouthwash all the time. I really wouldn't recommend a lot of mouthwash, anyways, because the alcohol in it's going to kill the good bacteria. So there is a line of supporting our good oral health, but not killing off too much of the good bacteria. So just make sure that we're taking care of our teeth. They play a very big factor with our digestion and our gut health. At the clinic, we actually have gotten some new products, some different toothpaste, different mouthwashes. And then if there's something more deeper going on with your oral microbiome, like an infection in your mouth or a bacterial kind of overgrowth, we have some good herbal products that we can use that will not harm your good bacteria. So while we're on GLPs, we also want to protect our bones and muscles. So this is key. This is probably one of those probably following nutrition. This is probably the next big pillar because just focusing on muscle mass first, every pound of muscle you have on your body burns 70 calories. So when we use the term basal metabolic rate, that means how many calories my body needs to stay exactly how it is while I'm doing nothing, while I'm sitting here and breathing. So knowing that number is going to help support your weight loss because we do have to somewhat consume less calories than our body kind of needs to help with the weight loss. But that number is going to be higher if you have more muscle on your body. So that's a good thing. You want a higher number because in theory, that means you can eat more and not gain weight in the simplest of terms. Now, if you lose a lot of weight and you lose a lot of muscle, then the number of calories your body takes to stay how it is going to actually be, could be significantly less than when you started. I mean, think of that. 1 pound of muscle burns 70 calories. It's not going to take many pounds of muscle and you're 500 calories less than what you needed before. Then that means if you stop the medication and you go back to eating how you were eating before, you're going to gain all that back and some because you have less muscle. So you have to gain muscle for weight maintenance and weight loss in general. Then we have to have more muscle to help with longevity. So muscle is a huge longevity component, meaning it's going to help us live longer and feel better. So we have to have the muscle for that. And then we have to have the muscle so that we are protected from injury as well. So we have to have muscle for many, many reasons. That means we have to incorporate strength training. That's going to work all of our muscle groups. You can't just do strength training once a week only for your legs. You have to do it for upper body, lower body. And then high intensity. So those interval things where you're switching from really hard stuff to some rest and going back through it. That's going to also help as well with building muscle. And then all those resistance training activities are also going to help support our bone health because we don't want to have any deficiencies that are going to potentially weaken our bones. So we have to make sure that we're eating in a way that's going to fix that. But then we also have to make sure that we're doing activity that's going to put just the right amount of stress on our bones to make them stronger. If we're malnourished, which doesn't necessarily mean that you're wasting away, it just means you're not eating the stuff that your body needs. A very big side effect of that is going to be bone loss, bone unmineralization. So osteopenia, osteoporosis, that's kind of on the rise because people aren't nourishing their bodies in a way to support their bones. So we have to make sure that we're eating and working out appropriately to protect our bones so that we don't have osteopenia or osteoporosis at any age, but especially not in our 40s and 50s.
So the one thing with strength training, if you can do strength training at home with just your body weight. It doesn't have to be anything fancy equipment or anything like that, but we got to do strength training. If you're more interested in a class, there's classes in most communities that do, some exercise, which are fantastic. There's gyms, but again, you can do simple things like wall push-ups, squats, sit to stand from your chair, anything with weight bearing, and then progress it from there. But we got to do weight bearing exercise and strength to keep our bones and our muscles strong.
Got to get good sleep. So making sure you're going to bed and getting up at the same time or, within that same hour on a regular basis. Have to keep routine. Make sure our environment is good. So making sure our room is dark, our room is cool, it's free of clutter, it's a space that promotes rest. And then try to avoid doing extremely stressful things right before you crawl into bed, because that's going to raise our cortisol level and it's going to make it a lot harder to fall asleep. But then our sleep isn't going to be very restful because our body's going to be kind of in this stressed state. And then reducing your screen time and reducing that blue light before bed is going to be good as well. And then making sure you're kind of screening for disturbances. So of course, like you probably can't, get rid of the young child that has to wake up in the night, but see what maybe is disturbing our sleep on a fairly regular basis and see if there's ways that you can reduce that.
And then, sleep is when we heal from things. It's so important. If we have injuries, we don't exercise as well. So we need to get our sleep to heal, but sleep is a foundation. If you don't sleep well, it's hard to get over anything. So we got to sleep well.
Fatigue, while we're on GLPs, fatigue can be a big side effect, and that can be from a couple of reasons. A big one is because the calorie deficit is too large. So like I mentioned a couple slides back, our basal metabolic rate, that's how many calories we need. Calorie deficit is what that means is eating below that. So, easy example, let's just say your BMR is 1,500 calories. A good calorie deficit that's going to be supportive, but not too much, is probably 1,300, 200 calories below that, roughly. If you're very, very active, you could try just going 100 calories below that. Too large is if you are lowering that far too much. So if you have a BMR of 1,500 calories and you're only consuming 1,000 and then you're working out, that's probably too much. And you're not putting enough fuel in for running your body and the demands you're asking. So that can certainly be a big side effect of, or that can be a big cause of the fatigue. Then also, if you have some nutrient deficiencies like iron in particular, if your iron is low, you are not going to feel very good. If your vitamin D is low, B12 is low, you're not going to feel very good. You're not going to have a lot of energy. And then simply, sometimes we're just not hydrating well enough. We don't have the electrolytes, and that can be a simple thing to kind of try on our own. But if this fatigue, if you have considerable fatigue while you're on the medications, it's going to be best to probably visit with somebody, whether that's coming into our office or going back with your prescribing provider to discuss with them, have a little further investigation, and see maybe what needs to be improved to change. Managing stress while we're on the GLPs, make sure you're incorporating those mindfulness practices, whether that's activity, like walking, music, or even practices like journaling, or your spiritual practice. Incorporating those on a regular basis is going to help to mitigate that stress and having good ways to kind of manage the stress better. The other thing with stress is that when it comes to eating and our eating behaviors, they can be very emotionally linked. And so it's very common to hear people talk about when they are going through a stressful scenario or they're having more stress, they may have changes in their eating habits. Many people in these scenarios are going to be talking more about eating more during those times. They may tend to eat to kind of cope with that. And so that is a component that we have to navigate because that could be one of those lifestyle things that needs more work for you to be successful on and then eventually off of the GLPs. So it's really important to kind of become aware of that, have that self-awareness, and then figure out what those strategies are going to be so that we're not tending to go towards increasing our food intake when we feel stressed out.
And typically, when that stressful eating is eating processed foods. So we've recommended to people in the past when they're hungry, drink water. And if you're still hungry, evaluate why you're hungry. And if it is related to boredom or stress, reach for that apple and almond butter, something like that, versus reaching for those chips and see if you're really hungry or you're just stressed and doing things. But this is a huge thing here.
And then build your support system. So make sure you have people in your life that are supportive, working with a health coach, dietitian, to help support your goals. And then oftentimes the mental health provider is going to be very important because, like I said, those emotional eating behaviors, they're not usually just a very simple thing. And so sometimes some more support with that is needed to make sure we are going to get to the root of some of these challenges that maybe have attributed to why you're at a point where you're trying to use more support to lose weight. So don't be afraid to build a good team that's going to be very supportive for you because if you're going on these medications, you should have goals and things you want to reach and achieve. So why would we not bring those supports in to help that?
And when we talk about a support system, this is friends, family. You want to build that health group that is supporting what you're doing and doing like-minded things that you're doing. And that is so important as we move forward with this. You can bounce stuff off of them. You can go to the gym together. You can go to, you know, seminars or whatever, things that are supportive of what you're doing. So build that support team is super important.
So just to kind of summarize it, the information from our previous webinar and this one, most people do notice that they're less hungry, they're eating smaller portions, they have less cravings in those first couple of weeks. It is usually pretty quick. However, a large portion of people do stop the medications for several reasons, whether it be side effects or costs. There's usually a reason that they're stopping that, pretty quickly. The medication does have a lot of benefits and it does have a lot of side effects. So you have to raise your pros and cons, weigh your pros and cons to decide what's going to be the best step for you. But bottom line is The medication is not a standalone solution for long-term success. You simply cannot go on the medication and do nothing else and expect to be successful, period, but expect to be successful off of it.
So when we
So
talk
now,
about when we talk about the pillars as Ashley touched on of food, exercise, sleep, stress reduction, a support team, those are the five pillars of anybody's health. If we were here talking to you about chronic low back pain, those are the same things we'd be touching on. If it was diabetes, heart problems, whatever it is, those are the pillars for your health. So while we can help you with this problem, those things will help you with all problems, and we can help you with those problems also with this. But we must focus on those five pillars when we're doing the GLPs to have greater success and greater impact on our health and give us our ability to get off of them.
so now I want to roll into talking a little bit about natural ways to increase your own GLPs so that you can taper off the GLP successful or simply just reduce your need for them altogether. So in regards to nutrition, a lot of this is all the same stuff that we already talked about. So we're not going to talk about them as heavily um, because eating enough protein, focusing on whole foods, that's going to be the key components anyways. Then when your body is healthy enough and you're to a good point, we can consider intermittent fasting. We can incorporate different probiotics and prebiotic foods, but also specific probiotic strains like Akkermansia that there is research that supports that that's going to help with weight loss. Getting plenty of fiber. 10 grams per meal is a good benchmark. 35 grams is what's recommended a day. 35 grams is, that number doesn't seem very big, but that takes some work. Chewing and eating slowly so that we can slow down that digestion on our own. And then utilizing different herbs like turmeric and cinnamon, that's going to reduce inflammation. It's going to support our gut. It's going to be good with blood sugar balancing, and then in turn, weight loss. So the nutrition pillars are pretty much the same. We have to really be focusing on that and really incorporating a professional with that because you don't necessarily have that stronger influx of GLPs with the drug that maybe shut down some of that food noise quicker.
So with those pre and probiotics, rotating your probiotics is a good idea too, and also going to short chain fatty acids. But we can get that through our food, especially. That's where we want to focus it. And then as needed, or maybe for short terms, do the probiotics, do short chain fatty acids, and that's important because again, that gut health is super important. And what we're saying here on this slide is, how can I increase my GLPs without having to go on a medication? Well, here's how. It's all listed there.
Movement, same stuff, but I want to incorporate a couple other strategies as well. We still want to do that cardio, those interval work, the resistance training. The other thing, which also if you're on a GLP, but the other thing is that post-meal walk, 10 to 15 minutes after you eat, is huge with balancing your blood sugar. But we were listening to something the other day, and they really highlighted the importance of how, yeah, that's great, moving after you eat, but you have to do it like right away. They measured people's glucose, their blood sugar, and they compared it to a person who they ate and then they went and walked maybe 30 minutes later, or a person who ate and went and walked right away. And that person that walked 30 minutes later, they didn't have that like significant decrease as a person who walked right away. So that post-meal movement is really a key tool to reduce our blood sugar and to increase our insulin secretion. But if you want to do it for that like immediate reduction, maybe you ate a high carb meal, you want to do it like right away. Make sure we're staying active throughout the day. We're not meant to sit and then move for 30 minutes. And then just continue to keep progressing your exercise routines, making it a little bit tougher as you go.
So move throughout the day. If you're at a desk, you can do a standing desk. Some people even do treadmill desks. If you have to make copies, do it on a regular basis. You can get up and move throughout the day.
So supplementation, there are supplements that can help increase our GLPs, and then also just support the goals that we're working on. So protein powders, glutamine, multivitamins and fish oils, great kind of bases and things like that, as well as vitamin D. Fiber, it's going to be hard to get it in your diet alone just because our diets aren't rich in fiber anymore. So fiber supplementation can be good. Creatine and amino acids can be really good for muscle building. Calcium can be good, of course, to support our bone health. Magnesium, fruits and greens products, and then, like we mentioned with the nutrition, there's different herbs that are good. You can do that in supplementation, like resveratrol and curcumin as well.
So these are
This
things
gets
that
a
are
little
good.
bit hard to know what you actually need, so that's where it's good to talk to somebody who can tell you what's going to be beneficial. Don't just go out and try and, buy a bunch of things. You're going to probably waste money and time.
These are things that you can do, not being on a GLP, but also on a GLP. These are good things to do there. The fruits and greens product, the thiocalcoid is a product that helps naturally increase our GLPs. So that's a really good product to help us with those increase in our GLPs and having all the benefits that we talked about before.
So CaloCurve is a very specific supplement. This is kind of like your alternative to a GLP, or to a pharmaceutical GLP. The active ingredient in there, they have done a lot of research and they're continuing to do webinars on it, on how it increases our own baseline GLPs, but it does not inhibit our body from producing them. So CaloCurve is going to be a supplementation that helps reduce our cravings, reduce our hunger, reduce our calorie intake, similarly to those GLP medications that people are being prescribed. And it can be good to help with the weight loss, to be just a standalone product, like you're not doing it with a GLP. But it can also be a really nice product to use when you decide you want to come off the GLPs. So, like I mentioned before, when you're on the GLPs, you don't produce as much GLP yourself. And then that can be why people kind of have that rebound effect. This can be a really good kind of like intermediate option while you're coming off the GLPs. And this can be kind of that middleman to help then support our body making its own, but still keeping us moving in the right direction, because it's not going to inhibit our own GLPs. So it's there to support it while our body kind of rebuilds that.
So when we look at the cravings, this has a 40% decrease, medications 40 to 60% decrease. Hunger, this has 30% decrease, medications 30 to 50%. Calories, this has 18%, medications 25 to 35%. So a great way to achieve many of those things through this supplementation, less money, less side effects, and key important, it's not going to inhibit our GLPs. You take this before you eat, and then it stays up for a while, and then it will go back down. Your natural GLPs will come into place, and then that's what helps you manage it through there. And again, this is something we want to be a short-term thing to where we're getting that lifestyle in there and that. So,
So this is a supplementation that we carry at the clinic. It's roughly, it might be give or take a few dollars, $120 a month. Now, the last people I were talking to, some of the lower numbers I've seen for the GLPs is at 220 to 250. So there is still a cost associated with it. It's still not something your insurance is going to cover, but it might be a much more affordable option than the GLPs. It's going to be great for people with the trying to manage their weight to get some body fat loss, transitioning off those GLPs, like we said. And then there are still things you want to do to support taking this product as well, like getting the probiotics, getting the fiber, building the muscle. We've mentioned the lab testing. So we feel it's really important to stay on top of the lab testing every 3 to 6 months so that you know where your biomarkers are at. You can correct them appropriately, making sure you're eating in the proper way, supplementation in the proper way. But other biomarkers to monitor would be like our body composition. So we can see what our weight, what our muscle mass is doing, because we talk so much about the muscle mass. It's really neat that you have the opportunity to see how your muscle mass is actually doing. Here in the clinic, we have the body composition scale, very accurate, very nice tool, takes a minute. Other things you can do to be tracking your biomarkers are things like our wearables, so our watches, our Oura rings. They're going to give you good information as well. So to wrap up, success depends on the habits that you create and having a support system around that. So you have to implement all of these strategies we've talked about. It doesn't mean you have to implement them all to a T, but pick little pieces that work with your nutrition, with your sleep, with your exercise, and do them very regularly. Experiences are different all across the board. You're going to talk to somebody who started a GLP, they lost 20 pounds right away, they felt great. You're going to talk to people who started a GLP, they stayed on it for a month and they thought that um, they thought that it was one of the worst things they ever did in the world. There's going to be experiences all across the board. So you have to always be advocating for yourself and figure out what the best way for you, what the best thing for you is going to be. Has to be lifestyle. It can't just be the medication. And then a GLP simply is a bridge from where you are right now to where you want to get to be. You can't only rely on it, but you can use it to support you to get there maybe a little bit quicker or a little bit easier. So we
So
appreciate, go ahead, Wade.
we're like I said, we're going to a conference in a couple weeks. If we learn more about the GLPs, we'll do a part three to this webinar. And if you have questions, make sure you contact our office. If you're on them or considering them or want just weight loss, we encourage you to contact our office and we can help you with your getting to your destination. We do visits through Zoom, so you don't have to be in this area, but we can certainly help you there and work with us there. I'm a functional medicine provider and chiropractor, and Ashley's a dietitian, and we work with many people with a variety of conditions to help them, as we said here, achieve their destination.
So if you have any questions, contact our office. We'd be happy to get you set up or can answer any questions that you have.